I'm starting my head to toe assessment and I'm scanning the room, and there's my male patient, and there's the person going to be taking the video. Okay. Okay, I'm going to hand the video off to her.
Are you ready?
Yes. My name is Ashley Farmer. I'm a student nurse practitioner, and I'm going to be doing a head-to-toe assessment on my male patient. I'm going to check him all over. I'm going to check his skin. I'm going to look at his face. I'm going to check his chest under his shirt, his back. I'm going to check his legs and all over. He is normal for ethnicity. He's warm, dry to the touch. His skin is smooth and soft. There's no lesions. There's no scarring. There's no deformities or anything. Then I'm going to look at his head. It's normocephalic, it's midline, it's symmetric. Then I'm going to check his head. So his hair is black, it's soft, it's there's no depressions, no infestations, there's no tenderness, no masses, anything like that. I'm going to palpate his temporal arteries. There's no tenderness there, is there? Okay, so after temporal arteries, then I'm going to check his lymph nodes. So preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical. I'm not sure if I said occipital, but I'm going to say that one again. Posterior cervical, and then supraclavicular. So all of his lymph nodes, they're small, they're movable, they're painless. There's nothing wrong with those. Then I want to check cranial nerve number 5 trigeminal, and that's when I'm going to palpate the masseter. So I'm going to palpate the masseter, and he's going to clench his jaws. And then I'm going to also do the TMJ. So he is going to open and close his mouth. There's no crepitus, there's no subluxation, there's no problems in movement with that. I'm going to check sensory to the touch, light sensation. I'm going to touch his head, cheeks, his nose, his chin, and do you feel that? And does it feel light to the touch?
Yeah.
Okay. Okay. After that, then it's cranial nerve number 7, the facial ones, and that is when he is going to smile, frown, raise his eyebrows, puff his cheeks, pucker his lips. Okay, so all that's normal. Then I'm going to do his ears. So I'm going to look at his ears, both his ears bilaterally. They're normal. They're in the same position on both sides. I'm going to check his pinnae, his tragus. There's no deformities or no problems there. I'm going to use my ophthalmoscope and my tip. Okay. And I'm going to check his auditory canal and tympanic membrane. So for adults, I'm going to lift his pinnae up and back. I'm going to look in his auditory canal, and inside his auditory canal, there is no swelling, no redness, there's no lesions, there's no exudate. Then I'm going to check his tympanic membrane, and there it's pearly gray. It's white, the periphery, it's concave, it's reflective light. There's no problems, no lesions or anything with that. And then I'm going to do cranial nerve number 8, the vestibulocochlear, something like that. Okay, so that's for the hearing. So I'm going to use the whisper first. I'm going to do the whisper first. So that's when I'm going to move behind him. So I want you to cover your left ear, and I'm going to whisper, and you tell me what I say. Okay? And then I want you to cover your right ear, and then I'm going to go behind him on this side also. I'm going to say a number. Okay? And then I am going to do the Weber test with the tuning fork. So I'm going to do that, and I'm going to place it on his forehead. And do you feel that on both sides bilaterally? Okay. Then I'm going to do the Rene test. So I'm going to do this. I'm going to put it on the bone behind his ear. And just let me know when you don't feel it anymore.
Don't feel it.
Okay. And let me know when you don't hear anymore.
Don't hear it.
Okay. And I'm going to do the same thing to his other side.
Don't feel it.
Okay.
I really can't hear it.
Okay, so the air conduction is greater than the bone loss on that. Let's see. Okay, so then I'm going to check his eyes. So I'm going to look at his eyes, and I'm going to open up and look at both of the inside of his eyes. His conjunctiva is pink and moist. The sclera is white. There's no drainage or discharge or anything. I can't remember. Let's see. The optic cranial nerve, number 2, the visual acuity, and the peripheral. I'm going to check that. I'm going to use that as Snellen eye chart. So let me grab a piece of paper. Okay, sorry. Okay, this is just the video consent form. So we're going to pretend this is a Snellen eye chart. Okay, so I want you to cover your right eye, and I want you to read me the lowest line that you can read me the letters.
A, B, C, D.
Okay, and then cover your left eye and read.
A, B, C, D.
Okay, and then put both hands down and read.
A, B, C, D.
Okay, so his vision is 20/20. Okay. And then I want you to keep your head still and follow my finger. Okay, so his vision is normal, 20/20 vision. And then try cranial nerve number 3. Okay, so that is where I'm going to do check. I'm gonna use a pen light and I'm gonna check. So I'm gonna shine the pen light in, and so when I shine it in the right eye, it should constrict, and the other one should. The right eye should constrict, the left eye should constrict consensually. On the other side, the left eye constricts, the right eye constricts consensually. When I'm looking at him also with a pen light, he has red reflexes. His optic is visible. The fundus is free of lesions. Okay, let me think. Okay, so his nose. Okay, the nose. His nose is midline, it's straight. There's no problems looking at his nose. We're going to check for patency. So I want you to close one of your sides, breathe in and out through the other side. Okay, and then change, breathe in and out. Do you have any problems breathing? So his nasal patency is open. I'm going to go ahead and check his carotid arteries. So I'm going to palpate first his carotid arteries. And then I'm going to auscultate on the bell side for bruise. And there's no bruise. And then I'm going to do cranial nerves number 3, 4, and 6. And that's where 3, 4, 6. That is where. Okay, I went blank. Okay, I'm going to come back to that. Let's see. Let's go ahead and do his trachea. His trachea is normal. There's no problems there. I'm going to go behind him to feel his thyroid. So turn your head to the front and to the side. And I'm going to check, and to the other side in the front. I'm going to check and swallow. Okay. There's no nodules or enlargements or anything like that. So his lips are pink, moist. There's no cracks. I am going to open your mouth and look and everything. His teeth are straight and midline. His buccal mucosa, his palate, his lower part of his mouth, his gums, all of that is pink, moist. And then I'm going to have him open his mouth and say ah. And his uvula and posterior pharynx rise and falls symmetrically and with phonation, and that is cranial nerves 9 and 10. And sticking his tongue out and say ah. Okay, and then let's see, red reflex. I did his mouth. Okay, while I'm thinking about it, I'm going to go ahead and check his cat refill on his fingers. Less than 3 seconds. On his toes, less than 3 seconds. I forgot for his skin earlier to check the skin turgor, and it's intact. I'm going to have him do cranial nerve, the accessory one, and have him shrug his shoulders. So shrug your shoulders, and it's normal resistance for that. For his neck, I'm going to have him flex, extend, hyperextend, lateral flexion to the sides, and rotate all around. There's normal range of movement. Let's see. Let's go ahead and let's go ahead and listen to his chest. So I'm gonna start with his posterior chest. So I'm gonna have you, if you'll just kind of turn to the side a little bit. Okay. Okay, so I'm gonna listen to his areas. I'm gonna go from, first, okay. First, I'm going to, if you'll take a deep breath in and out. Okay, so it's symmetric. It doesn't like he's using like any extra muscles. He's not tachypnea. There's no cyanosis. Everything seems symmetric. So I'm gonna listen to the areas, to the lung fields in the back. So just breathe in and out. And 1, 2, 3, 4, 5, 6, 7, and the sides, 8, 9, 8, 9, and it's clear and there's no adventition breath sounds. I'm gonna put my hands on your back for the tactile firmitus, and you're just gonna say 99,
99,
99,
99,
99,
99.
99. I'm gonna do that in several areas, and the vibrations are normal. And then I'm going to do tactile firmitus. That I'm gonna go ahead and check for CDA tenderness while I'm back here doing this before I forget. Was there any tenderness there? Okay. And then I'm going to do tactile firmitus. Oh, I'm gonna percuss his back in several areas. Okay, so all that seems to be normal. Okay, and then so percuss, I did that. And then I'm gonna do the agophony. So he is going to say the letter E.
E, 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 E.
Okay, I'm gonna do that in several of the lung fields. And then he's gonna do bronchophony, and he's gonna say the letter or the numbers 99.
99, 99, 99, 99, 99.
So I'm gonna do that in several lung fields. And then he's gonna do, he's gonna whisper. So just whisper and say 99. So I'm doing that in several areas also. Okay, so you can turn your legs back around. So I'm gonna check out his anterior chest, and I'm going to inspect that also. So I'm going to grab him, and if you will take a deep breath in and out. Okay, it's symmetric. It rises and falls. Everything's midline. There looks to be no problems with that. I'm going to listen to him in the area. So I'm gonna, if you'll just breathe in and out normal. 1, 2, 3, 4, 5, 6, 7, 6, 7. Okay. And then I'm going to do his heart sounds. I'm going to use the bell and the diaphragm. So this, I want to listen for the heart sound. So this on the right side is aortic, on the left side is pulmonic, and after pulmonic, then it's herbs, then it's mitral, then it's tricuspid or PMI. And the PMI is going to be right around the mid-clavicular 5th intercostal space. And I'm going to feel for that. And then I'm going to do the apical pulse. So I'm going to turn it to the bell side. I'm going to listen for 1 full minute. And when I listen for 1 full minute on that side, his beats per minute 65. The rate and rhythm's normal. Let's see, rate and rhythm's normal. S1, S2 is heard. There's no S3, S4, there's no murmurs, no gallops, so all of that is normal. And then I'm going to have him lie down, and when I have him lie down, it's going to be at a 30 to 45 degree angle, and I'm going to check for any jugular vein distension, and I don't see any jugular vein distension on either side. There's no heaves or lifts or anything. And then I'm going to also do the heart sounds that I did while he was sitting up. So I'm going to use the bell and the diaphragm side on both sides. So I'm going to do that and all those same areas. And then I'm going to switch it to my bell side. and aortic, pulmonic, herbs, tricuspid, mitral, or PMI. So I'm going to do all those. There's S1, S2, there is no S3, S4 heard. There's, okay, so that, and then I'm going to do his abdomen next. So I'm going to look at his abdomen. He's a little boy, so it's skinny, it's soft, and it's flat. So I'm going to listen to it first to all 4 quadrants on my diaphragm side. So I'm going to listen to the left lower, left upper, right upper, left lower. It's normoactive. Then after that, I'm going to change to my bell side. And for the arteries, so I'm going to do the aortic, the renal, move down a little further, the iliac, and then the femoral. So I'm checking all those. And then I am going to percuss the abdomen. So I'm going to do that in all 4 quadrants too. So I'm going to do those. There's no tenderness or pain or anything. Then after I do that, I am going to palpate for any tenderness or masses. So I'll do a light and deep palpation in those areas, and there's no tenderness or masses. Then I'm going to do the right upper quadrant. I'm going to do the liver, and I'm going to palpate for that. And there's no, take a deep breath in and hold, and I can feel the edges of that. Then I'm going to feel on the left upper quadrant for the spleen. It's not palpable. Let's see. So I did that. So then I'm going to have you sit back up on the side of the table. Okay. I don't know if I checked your radial pulses earlier, but I'm going to go ahead and do that. Squeeze my hands, and you got a good 5 out of 5 squeeze grip. I'm going to go ahead and do your joints. So I'm going to check your fingers, your wrists, your elbows, and your shoulders. And he doesn't have any problems with anything. There's no swelling. There's no redness. There's movement easily. There's no crepitus. So he doesn't have any problems with his joint. And we did his grip strength. And we're going to do the hands. So if you will do each hand back and forth and do the other hand back and forth. And if you will touch your index finger to my index finger, just touch it to it and touch it to it. And then touch, touch. And then do the finger, do your fingers like that. So he seems to have normal cerebellar movement. And then, okay. Range of motion. Let's do range of motion or of fingers. Okay, so fingers we're going to, okay, let me think. Flex, extend, hyperextend, radial deviation, ulnar deviation, abduction, adduction, and thumbs. Okay, and then we're going to do the wrist. So flexion, extension, hyperextension, and you're going to rotate those so you don't have any problems doing any of that. And then elbows. So, okay, flex, extend, hyperextend. I don't know. We're going to move those arms. Like we're going to move those elbows every which way we can do. Make sure there's good range of motion. Okay. And then, let's see. I am going to go ahead and do deep tendon reflexes. So, I am going to check, okay, brachioradialis for reflexes, and then biceps, and then triceps, and then patellar. That was a good reflex. And then Achilles, and then Babinski, and Babinski was negative. And then let's shoulders, range of motion. Okay, and you can move your shoulders and everything. Let's see. The tuning fork. We need to do the tuning fork for the proximal ulnar prominence. So we're going to do that to make sure he can feel vibrations on that. And then I'm going to do the medial malleus, that he can feel that. I didn't check, I'm not sure if there was pulses on there or not, but I'm going to check his dorsalis pedis pulse. I'm also going to check resistance in his feet. So if you'll just push up on my feet and down on my feet, or on my hands, just push up and down for the resistance, and for the patellar, up and back. Hips, if you'll just out and in, and then I'm not sure why I'm forgetting on that. Hands, okay, I don't know, I might have to come back to it. Okay, I need to do the, I know I need to do, okay, close your eyes, and I'm gonna do the graphesthesia stereogeny, that word. Okay, so I'm going to put something in your hand, and you tell me what it is.
A cotton ball.
Okay, what's in my hand?
Paper clip.
Okay, and then I am going to write a number.
Do it again.
Okay.
0.
Okay. And then I'm going to do the light sensation touch. I'm going to go ahead and do that to his upper and lower extremities. And just let me know if you feel that. And does it feel soft?
Yes.
Okay. So the light sensation to his upper and lower extremities. He can feel that. And then, let's see. The lower extremities. Okay. We did ankles, knees. I'm forgetting something with the lower extremities. Okay, toes. I know we did toes. Okay, so we're gonna do point them down, point them up, and then outward. Do your feet outward and your toes outwards. Spread your toes apart, and then your toes put them together. Okay, so we're testing for the flexion, the abduction, and we're doing all that with his toes. And then, let's see. I forgot what else I'm supposed to do. Okay, go ahead and stand up. I'm going to do a few other things because I can't remember exactly. So I'm going to go ahead and do his check for his spine. So if you'll just bend over, I'm looking at his spine. I'm checking to see if it's normal, if there's any deformities or anything. And he is, there's for any signs of scoliosis or anything. We're going to do his hips. So he is going to wait, your feet are together. Okay. Put a foot in front and then a foot to the side and to the back. Can't remember exactly. And then put your foot up like that and then inward. Okay, so we're doing that both sides. We're going to do that bilaterally, and we did leg out and everything. So we're doing that bilaterally, and your knees, we're going to do that too. So we're all this is like the extension, hyperextension, and that. So we're just putting your knee up, out, up, back. So we're going to do both sides of that bilaterally, and we did his spine, his strength. I didn't do your biceps and triceps strength. If you want to sit back down, that's one thing I know I forgot. So biceps and triceps strength. So if you'll just push on me, and then I'll just push on you, okay? And the same thing, okay? And then I'm gonna go to this side and do the biceps and triceps resistance. So it's 5 out of 5, so that's normal. Go ahead and stand back up for me. I'm gonna do the gait. Sorry, I'm going back and forth with some of this as I remember it. Okay, so he's going to stand here first to do the Romberg. So you're going to stand here, you're going to close your eyes, your hands are going to be by your side. I'm noting that he's got normal body movement, coordination, and everything. Then you can open your eyes, and I want you to walk forward and then walk backward. So his walk, his gait, his tandem, everything's normal with that. And let me see if there's anything else. How many minutes am I at? Does it say?
24.
24. And he's going to hop up and down on one foot and then hopping up and down on the other foot. And That's it for my head to toe assessment. Thank you.